Hello and greetings. My name is K. Sotinathan from BPT26B, and along with my classmates, we are going to present on our occupational health group presentation titled as Safety Hazards. My group mates consist of Angie Chu, Viren Harjai, Sara Ranjini, Sri Revadi, and Sotinathan myself. Together with this group presentation, we also have attached our video on the demonstration of the safety hazards that has been done in the physiotherapy lab. Now, let's us take a look into the background of safety hazards. In the clinical and physiotherapy training environment, such as our physio lab, we have to maintain and we are maintaining OSH standard, which stands for Occupational Safety Hazard Guidelines, in order to prevent injuries, protect patients, and ensure a safer workplace for both therapists and the students. Despite being a learning setting, the physiotherapy lab may contain potential hazards which can lead to severe consequences if mishandling occurs. Together with this, we also have attached a role play session in the form of a video at the back of this slide. So they have listed four most common overlooked hazards in the physiotherapy department, such as bad lifting techniques, slippery floors, electrical risk, and even improper thermotherapy handlings. This real situation occurs very frequently in physiotherapy lab, and this is most likely due to human error, lack of knowledge, and non-compliance with the standard protocol.
Greetings everyone, I am Sarah Ranjini, anak perempuan Cyril Phillips. I am presenting on Hazard 1, the bad lifting technique. In the bad lifting technique, there are three things to consider: the category, the description, and the example from the scenes. Firstly, will be on accident and hazard category, the description, incorrect lifting technique. The example from the scene: student bends back to lift a heavy object after saying, I saw this on TikTok. Moving on to the next category, risk. The description: musculoskeletal injury. The example from the scene: high chance of back strain, slip disc, or muscle sprain. Coming to the third, the effect. The description on the description is physical harm. The example from the scene: student feels back pain, potential back pain and potential need for medical attention. Next and last to consider would be control measure among the categories. The description, the description, proper lifting technique, and the example from the scene: bend knees, keep back straight, lift using legs, and hold the load close. That is all from me. Moving on to the next. Thank you.
Alright, hello. I'm be talking about hazard number two, which was the slippery floor. Okay, for the category under AREC, accident of the hazard is the slippery floor due to the spilled substance. An example from the scene is the ultrasound gel on the floor, creating a slipping hazard, and the student almost slipped on it. The risk being slip, trip, and fall injuries. The example from the scene will be a possibility of fractures, sprains, bruises, or head injury. Effect: potential physical harm. Example from the scene: the student nearly falls. Control measure will be to the immediate spill up. Example from the scene: the supervisor instructs, clear that. Keep the ultrasound gel away from your bag immediately. Alright, thank you.
Hello, Mika.
My name is Sri Revati. Today I'm going to explain about hazardry, which is electrical chaos. So now I will explain this hazard using the AREC, which is approach, which stands for anticipating, uh, re- uh, R for recognizing, E for evaluating, and controlling, C. So first we are starting with anticipating. This is where we try to predict what hazard might occur before anything happens. So in this situation, in a physiotherapy lab, we already know that electrical devices and liquids do not mix. So we anticipate that placing water near active equipment, which is the ultrasound machine, could lead to danger. So next is recognizing. This is when we identify the actual hazard. In our scene, we clearly recognize that the water bottle placed beside the switch on ultrasound machine, which is unsafe. This step is about noticing unsafe behavior, faulty equipment, or any condition that could cause harm. The third step is evaluating. Here we assess how serious the risk is. So we think about the severity, the likelihood, and who could be affected. A small water spill can cause electrical shock, device malfunction, or even electrocution, which means the risk level is high. Evaluation can also involve tools, for example, portable appliance testing, multimeters to check for leakage current, or risk assessment checks. Finally, we move to controlling where we decide the best way to reduce or remove the hazard. We use the theory of control starting from the most effective elimination, which is completely removing liquids from electrical treatment areas, which is shown in the video, and substitution using safer equipment like wireless or battery powered devices, engineering controls, which is adding cable management, waterproof covers, or installing safety devices like RCDs, and also administrative controls, which is safety rules, SOPs, training, and clear signage such as no drinks near equipment. So overall, the RX method helps us understand the hazards step by step, and Hickory of control shows us the safest and most effective ways to manage risk.
Hello madam, my name is Angie. Now I will do the presentation of hazard 4, which is the hot pack burn. In the category of air represent accident or hazard. So in this condition, the hazard is incorrect thermotherapy application. In the video, it shows the student use only 2 towel layers instead of the required minimum 6 for hydrocollator hot pack. R represent risk. In this hazard, the risk is thermal burn injury, so the patient may suffer superficial or deep burns due to excessive heat exposure. E represent the effect, which is the immediate skin overheating and pain. So in the scene, the patient reports intense burning on her skin. C represent the control measure. So we need to follow the proper towel layering protocol. So in the video, it shows the student always use 6 to 8 layers of towel, check the skin frequently, and ensure the hot pack is not too hot for the patient.
In the physio lab, safety is important because, as you're about to see, these people desperately need help.
sir. I saw this on TikTok. My spine just resigned.
Back pain. Your spine is not a crane.
Use your legs.
Why is the floor smoother than my love life?
Ultrasound gel, the silent killer.
Clear that.
It's just a water. What's the difference?
No, do you want to become the patient?
Physical hazard. You're a physio, not Pikachu.
Thermography time. I got this. Okay, six. It means we are breaking a muscle from the street. 2 really is enough. It's like my leg is on barbecue mode. Oh no, this is the level 5 thermotherapy, the maximum. I told you, this is not nasi lemak. I'm sorry, heart.
Why is the patient smoking?
Minimum tower economy.
Minimum 6 layer. We treat patient, not roasted.
At least it's
Physio is fine until somebody goes to occupational health. Okay, let's go. Hands, all hands on deck. Let's go. 1, 2, 3. Safety first.
I need a vacation.
Okay, that's all for our presentation. Thank you, madam.